90% of people living in Nigeria don't have medical insurance. This means they have to finance care out of pocket, pushing millions of people into poverty every year because of catastrophic healthcare financing. Now, the problem is that people don't buy insurance not because they cannot afford it. People simply don't buy insurance because they don't think it really works. Take Aisha, for example, a 29-year-old janitor who lives in Lagos. She makes about $30 and lives with her 3 children. She has never used insurance before in her life because she believes the paperwork is complex, too many paperwork, confusing and complicated. She has also heard of horrible stories of people denied care even though they had insurance, as well as the frustrating effort just to make insurance claim. She simply believes it's best to pay cash so that you can access care when you need it. Now, when Aisha has malaria, Aisha has to pay out of pocket, further depleting her income, pushing her into poverty, a problem faced not just by Aisha, but by millions of people across Nigeria and other African countries. We at SOSO CARE, we use technology to help Nigerians to trust and access insurance by making it simple, community-driven, and affordable. Now, here is the best part. We even allow them to finance insurance using recyclable. This way, they can access insurance without risking anything. Now, let me show you how it really works. Now, Aisha hears about SOSO CARE through a community agent that stays in her neighborhood. Aisha gives this agent a couple of bottles, and our technology, which makes it simple that anyone can access insurance without technology, allows Aisha to get insured within minutes through the agent. Aisha now has insurance, and the agent that insures this end-to-end process gets a commission from SOSO CARE. SOSO CARE uses our technology to ensure that these recyclables are sold for a profit in order to finance the entire insurance process. And so now when Aisha needs care, we provide end-to-end support for Aisha, making sure Aisha can access quality health care, even ensuring that the care is approved before Aisha gets to hospital. No paperwork, no long waiting hours, just care as Aisha needs it, which is something that millions of people also need to test how insurance really works. Now, here is the problem. Now, majority of medical visits in Nigeria is malaria-related. We are targeting 50 million low-middle-income people in Nigeria through our $10 malaria insurance. This gives us direct access to $500 million in revenue, a portion of $9 billion healthcare markets in Nigeria. What makes us unique is that we are trying to remove the barriers in trust and cost. By removing cost problem, we allow people to actually test insurance without even risking money. They could actually use their recyclables. And the best part, through community agent, trust is there. They can rely on this agent to finance their insurance, what traditional insurance companies cannot really achieve. I'm Nonso Oporom, founder and CEO of SOSO CARE. I've worked with ECOWAS on multi-million-dollar projects to improve quality standards of projects coming from Nigeria into the EU market. My co-founder Nkem leads operation and finance. She has trained hundreds of women around financial literacy as well as entrepreneurship with support from USAID. Over time, 50,000 people have accessed insurance on SOSO CARE. Now, here is the best part. 90% of these people actually bought insurance for the first time. The greatest part, 60% of them came back to renew their policy, demonstrating trust, which is what we're trying to achieve. We've been able to generate 20K in net revenue, and we are growing 10% month on month.